What are those 5 key tips there?
I won't say them in order, but making sure that you brush twice a day, so morning and night ideally.
Mm-hmm.
At night time, you want to make sure that you're not going to be eating and drinking again after
brushing.
After brushing, because we don't have a lot of fluoride. Well, we don't have any fluoride in our water yet. Hopefully that will change. So back to that.
Fluoride.
So fluoride is an important building block for your enamel, which is that hard protective shell on your teeth. So that hard shell, that is your protective layer to protect the inner aspect of the tooth. When you get a cavity, you've basically had a little bit of erosion of that. You've got a hole through that protective layer. And then once you get that, it just sort of progresses, and that's when you have a cavity or a hole. When you go to the dentist, they fill it. So they'll probably numb it, remove any soft or yucky stuff there, and then fill it back up. So enamel is your protective shell, and fluoride, which is the main and very important ingredient in toothpaste. I'll come back to those tips. I think we'll give you some basic oral health information first. But so fluoride is a key part to maintaining enamel. So it will help prevent decay as well. So, like I said, we talked about fillings. You need to use a fluoride toothpaste when you're brushing twice a day. Okay, so a fluoride, most of those mainstream ones that you'll see in the supermarkets they have fluoride in them, okay, like the Colgates and the McLeans, or those mainstream ones, and Oral-B, they all have the right amount of fluoride in them. There are quite a few that are on the market that don't have fluoride, and that's a real concern for us, well, for me as an oral health practitioner, because that means there's no fluoride around in the mouth, given that we have no fluoride in the water here. So that's why there's been such a push about getting this fluoride bill and getting water fluoridated in New Zealand, because it's just a way to help protect oral health without too much more intervention, if you know what I mean. It's just an extra thing. It's that important that there's been a bill through government to fluoridate the water. But we don't have it yet. Okay, it's going to be probably a few years to get that through. But so using fluoride toothpaste, to be fair, once it comes through, you still need to use fluoride toothpaste. Okay, but I'll come back to the toothpaste. But making sure that you don't that you spit it out after you've brushed and don't rinse. Yeah. Okay. It's, I think we're probably taught that from a young age. But if you rinse your mouth out, you are washing all the fluoride away, so you haven't got any of that protective ingredient around. Okay. So you want to brush for 2 minutes in the morning and at night, spit it out. Yeah, it's a bit weird, you get used to it pretty quick, but a bit foamy in there, but spit out any excess and then don't rinse your mouth. Yeah, key. So back to the fluoride toothpaste. So very, very important, just to check that you're using the right one, okay? So I'll come back to what you should check on the box, but most of those mainstream ones that you'll know the brands are fine. Red Seal is one that's, a lot of people move to because they think they're doing a positive change because it's more natural, but most of their toothpaste don't have fluoride in them. Okay, so they have brought one out, but you've got to obviously check the box which one you're grabbing. Okay, so just got to be a wee bit really important. Brushing twice a day with fluoride toothpaste.